Bueno, damas y caballeros, continuando con nuestro café con leche de esta mañana.
¿Le echaste azúcar?
Sí.
Sí,
Bueno,
está bien.
esplenda. Leche, sí.
¿Cuándo vas a dar la miel de abeja o sin azúcar?
O sin azúcar.
Ajá.
Un día
Doctora,
de esto, ¿no?
mañana no le eche azúcar. Yo voy a esconderla de acá.
Vamos a ver si hacemos esto. Y en buena hora, porque vamos a hablar exactamente de la diabetes. Nuevamente en esta mañana tenemos aquí con nosotros a Christy Gaiman y a Natalie Rosado, ambas de Heart of Lancaster, en Lidditz, en el 1500 de la Highlands Drive, 1500 Highlands Drive. Y están aquí con nosotros para hablar nuevamente sobre la diabetes. Welcome, Natalie and Christy. It's a pleasure to have you both here this morning. We're trying really hard to create awareness among our community of diabetes, being that the Latino community is one where the diabetes is an endemic disease, where it's certainly present more often than we would like it to be. Correct? It's definitely an endemic disease. It's considered that way.
Yes, and actually, the Spanish population is twice as likely to develop diabetes, and that's why Natalie and I really feel compelled to.
Is there something in particular that you could say this is the reason why it is twice as likely in the Latino community to see diabetes?
Well, in some of the literature and the readings, it does just talk about the access to healthcare as being one of the problems, and maybe also people going to the doctor. I think
that's an important
that we don't have. It's not.
Maybe they don't follow up with their doctor as frequently as some other populations do. There's also some lifestyle issues that over the generations have made them more likely to develop diabetes, meaning less physical activity and maybe some healthy eating. But it seems like there are, the Native Americans are also more at risk, but it seems like just from a genetic standpoint, they are at greater risk.
Now, undoubtedly, it seems that here in the United States, it is there is some kind of correlation between the level of poverty and the incidence of diabetes, because we know well that when we're talking about Latino community, when we're talking about Native American community, when we're talking about African American communities, we're also talking about the poorest communities in the country, correct?
That is true, and some of that has to do with literacy and like we talked about, access to healthcare.
Access to healthcare. Now, if somebody is listening to us right now and is concerned about diabetes because they know their parents are diabetic or grandparents diabetic and some uncles, aunts, what are the signs and symptoms that they should be aware? What are the things that they could say, this happened to me yesterday, these are the things that happened to me, I should go to the doctor and check myself?
Well, some of the signs and symptoms that you could have that are associated with diabetes would be like tiredness, if you feel more tired than usual. The frequency of urination, that's another one. Being more thirsty is definitely, I've seen more often one. You're much more hungry than usual. You get like blurry vision sometimes. One of the most key ones that it's really important to watch out for is infection that won't go away. Like if you get a cut or a lesion and it won't heal, that's definitely one of the main ones that you want to get taken care of.
Especially if it's something that didn't happen before.
Right.
Okay, so we're talking about a thirst that does not quench, no matter how much you drink.
Right.
And you're hungrier than usual. But isn't also that sometimes you're hungry than usual, you're eating, but you're also probably not gaining weight, correct?
That's right. People lose weight. People can
you're eating and eating and eating, yet everyone tells you, goodness, you eat and eat and eat, but you don't seem to gain any weight. So and then the infections. This is the first time that we hear it. So someone that all of a sudden gets a cut and the cut doesn't heal, it gets infected, and you can't get rid of it.
Yeah, it's not healing properly. That's something that, because they have a more poor circulation than normal people because of the diabetes that they're, and sometimes they won't feel it. Like if it's on their foot, their foot is numb because of the circulation is poor, they won't feel that they have that cut, and they'll just, go without.
Okay. Bueno, damas y caballeros, conversando con nuestras invitadas, tenemos aquí con nosotros a Natalie Rosado y a Christy Gaiman. Natalie Rosado es una asistente médico certificada y Christy Gaiman es una dietista, nutricionista en el Heart of Lancaster en Lidditz, y ambas nos vienen a conversar un poco más, refrescar continuamente este conocimiento sobre la diabetes, y nos dicen que si usted en estos días ha tenido una sed que no se le quita, fatiga, está comiendo más de lo normal, más sin embargo no aumenta de peso, ha tenido cortadas que le cuesta más sanar, que se están infectando y que no logra usted que sanen esas cortadas, usted puede, sobre todo si tiene historia en su familia sobre diabetes, usted debe consultar a su médico para saber si está padeciendo de diabetes. Puede que usted sea un candidato. Una de las cosas que nos han dicho nuestras invitadas es que una de las razones probablemente por la cual en nuestra comunidad la diabetes está más presente es por nuestra ausencia en la sala del doctor. Es decir, o no tenemos el seguro médico que nos permita ir al doctor, o incluso cuando lo tenemos no estamos yendo a nuestro médico, y para cuando se diagnostica, en vez de que nos diagnostiquen la prediabetes, nos digan, mira, te tienes que cuidar para que no te dé, ya cuando
diabetes.
Vamos al doctor ya somos diabéticos.
Mira, José, hay muchas personas que dicen eso. Mira, Héctor, yo nunca visitaba al médico. Comencé a visitar al médico porque sentí estos síntomas y cuando fui, ya me diagnosticaron con diabetes. Si hubiera ido quizás antes, me hubieran dicho, mira, cuídate porque estás prediabético,
Exacto.
tienes que bajar el consumo de azúcar.
O viendo la historia médica simplemente. And that is one of the things that we're talking, we're hearing this on our community over and over again. I didn't go to my doctor until I had the symptoms, and of course now I'm diabetic. The truth of the matter is that if we had a habit of visiting our doctor
More regularly.
For checkups, the doctor knowing our history and the doctor knowing our propensity, our risk, would have created preventive measures to not evolve into becoming a diabetic, which is the part where you're uncurable, because once you're a diabetic, you can control it, but you can't cure it.
That's exactly right. It is a lifelong disease.
It's a lifelong disease. Now, what can we do? Let's just say, so other than visiting our doctor, what are the things that we're usually going to hear from our doctor that will be the things that we do to prevent the onset of diabetes?
A healthy lifestyle, eating correct portions of your food, exercising regularly, knowing how much to eat and when to eat is definitely, because you're more hungry when you have, diabetes.
When you have the
Right.
but we're talking about preventing it, not when you have it.
Yeah, but more portion sizes and knowing when to eat and the right time of day, and regular exercise is definitely important.
So they're really relatively simple. I mean, these are the things that we hear all the time, basically just to maintain health, correct?
Right, that's right.
Exercise and eat well. And good healthy habits are so easy to
Pero menciona Nara algo interesante, y es el hecho de la hora. Por ejemplo, desayuno a una hora.
Yeah, exactly. What does that mean when she says how much to eat? Because Natalie says between the things about eating healthy is also when to eat. What would a dietitian recommend for the prevention of saying healthy eating? What is it that you would recommend in terms of that?
Well, in your community, there's a lot of foods that contain higher carbohydrates, starch, in other words, and it's very difficult to say.
Give us an example of which ones they are so that people know which ones they
And
are.
I don't know the exact words. Maybe you can give me an example. I know in talking with some of our Spanish nurses, I've heard of foods, but I don't know how to exactly say them. But I know that in the description, and maybe you can give me an example, but I know that there are I mean, an empanada, would that be something that you,
yes,
okay.
yes.
Is that
Yeah.
ringing a bell? So, and something like that would have a lot of starch.
Everything that
with
would have
bread.
flour, everything that would have
Yeah.
flour, anything that would be breads, like for example, white rice would be included
Rice
on a
and breads,
on a
exactly. And that would be very
starchy.
starchy.
Yeah.
And fruit is good for you, but it also is going to have a sugar content. So there's a fair amount of carb or starch in your diet. And so if people are able to eat even less portion sizes of those things and eat more vegetables, that has been very helpful. So
And that's an important thing because it's the second time Natalie said it, and now you're saying it. It's not necessarily just what you're eating, but how much of it. It's the portion size, and I think that that is a problem in which everyone in our society in general has gone array.
True.
We just have no idea what a portion is.
Very true.
We're used to going to restaurants and seeing our plates full of pasta, and we think that, oh, this is how they do it
This
in
is a
Italy. They
serving.
just take it.
And
They
they
just take the
don't,
biggest bowl
right.
possible and serve themselves pasta until you can't see your plate, and then you empty it until you can see the plate, right? And
Exactly.
so,
Right.
how do we know? How, especially because not only do we do it for ourselves, but we're raising our children and we
Exactly.
serve our kids plates. How do we know when a portion, how do we know when it's enough? A most important question that I hear all the time from my daughter is, can I get up from the table, did I eat enough? Because that is usually, you know, we have this thing that empty your plate. How do we know when it's enough?
Ideally, if you think about your plate, you would think about having half of your plate or about 2 cups of it coming from vegetables. So salad or broccoli or some green beans or some kind of vegetable. And then a cup of it coming from some kind of starch, whether it's potato or rice or pasta. And then the other
So we shouldn't confuse that when you're saying vegetable,
with
because
it,
then you mentioned potatoes, and potatoes are a
It-
vegetable. So,
that would be the starch.
but
The
then we
starch.
need to make sure that not the fact that it's not, that it's a vegetable doesn't make it part of your vegetable cup.
Right,
Correct?
right.
The potatoes don't, because that's the problem that we have, that rice is a vegetable, so I think, oh, it's got to be healthy. Potatoes are a vegetable, so they have to be healthy, but they're not classified in the same source.
They would be your starch or carbohydrate. And ideally, again, it's not what everybody will be able to or willing to do, but think about that starch, whether it's a potato or sweet potato or rice or empanada, but anything on your plate that's a starch, about a cup. And then the other green vegetables, if you want to think of, and it wouldn't have to be limited to green, but salad or green beans or broccoli or carrots or peppers or onions, 2 cups.
2
on your
cups
plate.
of those.
And then the rest of your plate would be another cup, would be the protein.
The protein, which is usually the size of the palm of your hand.
Yeah, 3 to 4-ish ounces chicken or fish or pork or lean beef.
Now, does this apply to a child, or do we
It
have
would.
that?
It
So
would.
we would a child should eat 2 cups.
No, by child I mean adolescent.
Adolescent.
Yeah. I'm
So
just-
what do we do when we're, because the problem is that we are not teaching portions to our children from the get-go, and we're really, we how do we know that we're serving, or what is the guideline for a child that is already eating by him or herself at the table, and how do we know that we're serving the right amount of food for them?
And if you're talking under 10 years old, then you can have that. So half of a cup of a starch,
Okay.
1 cup of vegetable, and 2-ish ounces of protein.
A protein. Okay, so
Yeah.
because isn't that a tough question?
Yes, it is.
That
Yes, it is.
that I had enough, and we have a problem in the restaurant. If you order it, you have to eat it. You know, you can't be, and it's really difficult. We create this bad relationship for our
With
kids
food.
with food.
At home, Natalie, do you remember when abuela or mommy told you you had to eat all that plate of
Yeah.
food?
Yeah.
Right?
Yeah. And you're absolutely right.
Yeah.
It
It's-
is.
Because there is an association of emotional and
Yeah.
You have
family.
to eat it all.
And if you don't eat it all, then there's a punishment.
Yes.
And we begin this bad relationship with food. We begin this idea that there's something negative if you don't finish your plate. And actually, when a child asks for seconds, sometimes there's even a party. Oh my goodness, he's eating again. Oh, you're really and we don't realize either because of punishment or actually some party around eating too much that we have that we don't create this idea that portions are important from childhood and it's really difficult. Tenemos esa pregunta continuamente de cuánto es suficiente y nos están diciendo nuestras invitadas que para nosotros los adultos la mitad de nuestro plato, es decir, aproximadamente 2 tazas, deben venir del reino vegetal. Del reino vegetal que estamos hablando de los vegetales que vienen como hojas, tomates, cebolla, vamos a llamarlo vegetales crudos, pudiésemos decir así, Natalie, que sean vegetales crudos. Los vegetales como las papas, el arroz, todo esto son lo que se consideran almidones, son carbohidratos, que tiene que ser solamente una taza de ellos, una taza de
Dos porciones de lo que son vegetales.
Y una sola porción. Pero esa porción no es que es 2-1, sino tazas. 2 tazas de los crudos y una taza de ese vegetal cocinado que usualmente es un almidón y que es un carbohidrato. Y luego más o menos el tamaño de nuestra palma en la mano, es decir, unas 4 onzas de la proteína, la carne. Y para los niños, la mitad de todo esto. Niños menores de 10 años debe ser la mitad de lo que estamos hablando en cuanto a las porciones.
Y conversábamos con Natalie, jocosamente le decíamos, ¿te acuerdas cuando la abuelita o la mamá le decía a uno, no, te tienes que comer todo el plato y te quedas ahí? Y nosotros crecimos con
esa idea.
Y
no te podías parar de la mesa. Es más, yo recuerdo estar en casa de mi abuela y estar sentado solo en la mesa 1 hora más tarde porque no me terminaba el plato y estábamos sentados esperando a que eso sucediera. I was just saying that I remember being in my grandma's house alone at the table because I was the only one that didn't empty his plate. And just sitting there.
And there you sat.
There I sat for hours and hours until they got tired of me sitting looking at the plate. But every now and then you would just eat it just to get up and go play. Because that was my ticket to go and play. So starting a healthy relationship with your food from an early stage in life, certainly it goes a long way to not be an adult with diabetes. And the question that we always have, where do plantains fall?
A starch.
It's a starch.
It's a fruit, and so it would fall under that carb or starch.
And it's a very sweet fruit at that, especially when it's ripe. So a lot of sugar on a plantain.
And it's not that it's not good for you. It just is that it's, again, the
in
amount.
moderation is the amount that we eat.
And so eating healthy to prevent diabetes is not cutting those things out. It's just a matter of eating smaller amounts so you don't tax your blood sugars, essentially.
Now, then, and I'm sure that there's going to be a lot about eating here. Diabetes is a lifelong disease that affects your whole body.
It's exactly
From
right.
the tip of your toes
exactly
to the tip of your head.
To your brain,
Yes.
they're finding.
Exactly. So, how do you prevent exactly those complications all over your body and diabetes once you're diagnosed with it?
One of the things we often really emphasize with patients is taking medications.
Mm-hmm. So follow your doctor's orders to the T.
Yeah.
This is
seeing them regularly and taking your medications will also help. Just get, like, when you have diabetes, taking your medications on time, when you're supposed to take them and how you're supposed to take them is very important because it helps control your glucose levels in your body, and you just feel more energetic, and it's important.
It's important to follow that pace, and then, of course, I'm sure that the eating also plays an important role in preventing these.
in prevention, and then if someone is diagnosed with diabetes, then
Preventing the complications.
preventing the
Preventing
complications.
complications. It's, again, and it becomes even more important because it's not only, there are some things that you just should not eat, period, correct, that you should avoid.
It would be, again, that moderation and being able to have less of some of those things that are higher in carbohydrate. And once someone has diabetes, like Natalie was saying, it really is eating healthy and taking your medications, the goal being to keep your blood sugars where they need to be.
Where they need to
And
be.
that is how you prevent complications.
Now, if it was important to see your doctor for prevention, I mean, the
No.
regimen of doctor visits once you're diagnosed, it must be more important than ever because it is your doctor, the one that is going to tell you you're doing the right thing, you're doing the wrong thing, that you need to change this or you need to change that.
Right.
Now, in the team of professionals that would take care of you, who is there?
Good question.
Is it just a doctor? Who is usually? Is this a team approach?
It is a team approach. I mean,
Most
the
definitely.
first person of contact would be the nurse when you
Mhm.
go to the doctor's office. And there, that person has a responsibility of telling them, you know, you should get this checked, or, you know, this is important to check your eyes every so often for, you know, the diabetes, and
Their feet.
just see, check their feet and see if they have, because a lot of the times people with diabetes have numbness in their feet, and checking for that, and just making the doctor aware of what they're doing and kind of working as a team. And then that's when, if it's to a point where we want them to follow up with someone more in detail with their healthy lifestyle, that's when we would go ahead and give them to Christy here, and she would help them with what
With
they
the
need.
diet and setting up. Christy, it's so difficult for us because one of the problems with any culture is that it's very intimately, enamored with what you eat. And a lot of times we hear, well, you can't, but no one talks about substitute this, substitute that with that. How do we get to be able to still say, well, we're eating our food, but we're eating them healthier? We don't hear recommendations of, okay, this meal is usually fried. Instead of frying it, here's a good way to make it still taste good, but you won't fry it, you'll bake it, you'll, I don't know, boil it, whatever it is that you can do. Is there someone working with, if diabetes is so high in our Latino community, in creating a menu of substitution for meals?
It's a good question. The Spanish people that come to Cornerstone and some of the other practices that I go to, we would work individually with them and their families to just help them. A lot of it is just less of what they're eating because some of these recipes are actually hard to make substitutions. And so it becomes a matter of what choices you can make to have less of what you're doing, and oftentimes is what you're adding. So if they're willing to add, again, those vegetables, that helps with fiber, which helps their diet. So it tends to be, and there are some cases where there can be substitutions, but it tends to be working individually, working where they're at, because an older generation is not going to be very fond of making a lot of adjustments to what their traditional food is. So if they can just do less of it, less frequently, that is a very good place to start.
Una pregunta de nuestro amigo oyente. Demasiado dulce, demasiada soda. ¿Cuál sería el efecto para la persona diabética y cuál sería el efecto para la persona que no es diabética?
And there's always the question, and somehow sodas come on our show. Everyone knows that I'm a fan. I drink a lot of Diet Coke, a lot of diet soda in general.
I have to do part of my job,
Yeah.
which is trying to put you out of the soda, my friend.
But a lot of times we hear that even diet sodas. What is the regimen for diabetics in terms of sodas and sweets, and what is usually What's recommended for them?
Well, obviously, regular soda, regular iced tea, fruit juices are going to be difficult for them to fit in. That would
So it's usually a no with them.
it is usually a no, or
Regular
or a
and
teeny amount.
Very important. She said the word regular
I did.
sodas.
Regular
Sodas, regular iced tea. All those things are usually a no.
And
for.
fruit juice, and I do find that there's some people do drink a fair amount of fruit juice in your culture, so that is something to be aware of. But in the case of people with diabetes, it is better for them to drink diet beverages rather than regular. If they can drink water and even seltzer other than diet, that would be even better. But
So,
you just try to make steps and progress as you can.
so it's certainly, ahí lo escucharon, las sodas normales,
La regular.
la regular, lo que llaman la que tiene el azúcar,
La que no es de dieta.
la que no es de dieta, los jugos, por muy naturales
Sí.
que sean, son usualmente cosas que
Hay
son
mucho azúcar.
que tienen un no rotundo para los diabéticos. Y por el contrario, la soda de dieta es una buena sustitución, aunque Christy nos ha dicho que lo mejor sería agua o lo que llaman el seltzer, lo que es la soda sin sabor.
Ajá.
Sería la...
Aprovechando que están aquí nuestras expertas, este viernes es Halloween y hablando de sustituir, ¿cómo podemos sustituir o con qué podemos sustituir los tradicionales
portions.
dulces o porciones?
Yeah, it's interesting because Halloween is coming this weekend, and sweets are going to be ever present all over the place, right? So how do we, substitute? What would be our healthy Halloween tip for the kids?
Well, dark chocolate is going to work better than something like a Twizzlers or gummy bears or any of those candies.
So dark
that
chocolate would be
ideal.
Ideal. Yeah,
And actually
tell
has
my daughter that.
Right,
Yeah.
I know it's hard.
It's hard for a child to prefer dark chocolate than
Yeah.
milk chocolate.
It's
very
true.
difficult.
Things that have chocolate and nuts work better too. So peanut M&Ms, a Snickers bar in small amounts, that works better than something, again, like those completely sugar
So
snacks
in other
like
words, a
gummy bears or Twizzlers or
chocolate bar, a regular sized chocolate bar would be less healthy than a regular sized chocolate bar with almonds in it.
right.
Okay,
Because
so
you
would-
have the benefit of the
the
protein
benefit.
and the healthy fat in the nut.
And the nuts. So at least that substitution is making you better. But then realize the portion is maybe that it's going to be half or a quarter of that bar.
Like those fun size bars.
The
or-
fact that they sell you a full bar doesn't mean that that's a real portion,
Exactly.
correct?
Right.
Because that's where our confusion comes. We don't think that anyone's out there to hurt us, but they're selling us something as if it was a portion, and it really is not a
Right.
portion.
Right.
In that sense, right? So, damas y caballeros, el chocolate oscuro para este Halloween, mucho mejor. Si es un chocolate que tiene nueces, todavía mucho mejor,
Mucho
porque
mejor.
tiene el beneficio de las grasas saludables. Now, also, right after Halloween is Diabetes Day, right?
Yes.
What
that's right.
What are you preparing? What are you doing for Diabetes Day?
Well, we're going to be doing blood pressure clinic. We're going to have, I think Christine knows more of what we're going to have
Oh,
there.
well, it's at the Heart of Lancaster,
Right.
November the 8th.
That's at
and
1500 Highlands Drive, correct?
And that is, yes, November the 8th, 10 in the morning to noon. And there will be vendors that actually are a lot of local businesses. So an eye doctor, a foot doctor, we have.
Will they be doing checkups in general? For
And we
Right.
have, yes, and so free screenings. We have a lot of free screenings. We also have a speaker who's talking about taking the next step, so how you can make some progress with your health and diabetes. And then we do have door prizes and free food.
Okay. And free healthy food.
We do.
right? Free
We do.
healthy food,
Yeah, we do.
so,
Like
yeah.
hummus and a pumpkin dip, and we're doing small little wraps, and yeah, we do.
Yes, well, fantastic. So, el noviembre 8, de 10 a 12 del mediodía, de la mañana a 12 del mediodía, estarán en el Heart of Lancaster. en el 1500 Highland Drive en Lititz, tendrán esta feria para concientizarnos sobre la diabetes. Habrá muchos test gratuitos, seríamos free screenings, donde las personas, bien sea que ya tengan diabetes o que no lo tengan, pueden hacerse estos exámenes de manera gratuita de 10 a 12 en el 1500 de la Highland Drive en Lititz. Tendrán también, ahí va a haber una charla sobre el cuidado de la salud con la diabetes y cómo tener una mejor salud a pesar de tener ese diagnóstico.
Tremenda oportunidad. Christy, a question from our listener. Ginger ale has the same amount of sugar that regular soda has?
Does what?
Ginger ale has
Yes,
the same
it
amount?
does.
It's the same.
Unless
It's the
it's
same.
diet.
If
That's
it's
correct.
soda, it's soda,
That's
correct?
right. Yes.
And we're talking about 140, 170 calories per serving.
At
in a
least in regular Coke, it would be 250
250.
calories.
Wow. Calories. That's
Calories.
And usually a can of soda, how many spoonfuls of sugar does that?
About 16.
16. Una soda
1/6,
regular,
yeah,
una
16.
soda regular tiene alrededor de 16 cucharadas de azúcar. Cucharadas de azúcar.
¿Y cuántas calorías dijo?
250 calorías para la Coca-Cola normal.
De acuerdo a la trotadora donde yo hago ejercicios, en 45 minutos, o sea, te toma 45 minutos o más.
Para quemar unas 300 calorías.
Yes.
Yeah.
Señores, es serio.
Yeah. La meta tiene que ser quemar 300 calorías en media hora, Héctor.
Ya.
Okay.
Y yo estoy haciendo en una hora. No,
Okay, bueno, pero and we're just saying, you can be half an hour, 45 minutes on an elliptical or
True.
you know, to burn one
drink
can of
once.
soda, basically.
Right.
When you hear it that way, it is a pretty bad situation. So, especially Halloween is coming. If those chocolate bars, if your kids are eating those chocolate bars with a can of soda on the other hand, that is, and we haven't heard from the dentist yet, right? So, bueno, damas y caballeros, no se les olvide, noviembre 8, esta cita para conocer un poco más sobre su salud. Te puede aprender, bien sea para la suya, para la de un ser querido que esté padeciendo la diabetes, tener esta oportunidad de tomar el control de su salud en el Heart of Lancaster, 1500 Highland Drive. Será esta feria para conmemorar el Día Nacional, el mes de la diabetes, que es el mes de noviembre. El 8 de noviembre será de 10 de la mañana a 12 del mediodía.
Ahí en 1500 de Highland
Drive. Sí.
Yes.
Ahí está, señoras y señores.
Well, thank you very much, ladies. It's a pleasure to have you here.
Thank you.
We will have una breve pausa y ya regresamos con más aquí en Café con
Bien
Leche.
breve, gracias.